started. I think everybody saw we don't have cookies today. Lynn Finland is in the hospital. Please pray for Lynn. She has an infection. UTI, and anyway, it's become a big deal, and she's in the hospital. So no cookies today, but we have donuts and coffee in the back. But say a prayer for Lynn as she works to recover. I think all of you have heard the spiel, at the beginning, and so maybe we'll just get started. Again, except for Lynn, the only other change is that this is the third session of Cancer Now What, and we have the first session recorded. We have the second session recorded but not uploaded yet. Our technical guy, Law, was not here this week, and so he's going to help us get the second session uploaded, and the third session will be uploaded today or tomorrow, and they'll all be available for review in case you missed one of the other sessions.
And next week, Amy Weatherup.
And next week, Amy Weatherup, who is a cancer survivor, will be here. You may know her from last year when she did her presentation on hospice and palliative care and also dementia. She's a sharp lady and has had some personal experience with cancer, so I think she'll also give us some good insight. And with that, I'll turn it over to Becky.
Okay. And while we're thinking about Amy, I talked to her yesterday. She's, if you remember her, she's very animated. She's, and she is a cancer survivor, and she has quite a story to tell. So, and it really, her story and some of the things she brought up yesterday to me on the phone go very well with what we've been talking about. So I'm looking forward to that. So we're in session 3. This one's going to be a little bit less medical than it was last time. If you remember last week, we sort of ended on having a pretty thorough discussion on different modalities of treatment and really how these treatments have evolved and continue to evolve, trying to attack the cancer at its vulnerable points. We talked about cancer having some superpowers that allow it to thrive and grow and spread, and all of these different modalities are aimed in different ways to slow that down or certainly to eliminate it if possible. But we have, and we talked about how a person or a family member or a friend is helping someone maybe understand those choices and maybe help them make the decision. Remember, we talked a little bit about the paradox of choice. And sometimes when we have choices, it's like, well, you know, what would you do, Dr. So-and-so? What if it was your mother? Or what if it was your child? And you ask that question, and they maybe are very frank with you, but maybe they also say, you know, I would just have to think about it because there's advantages to this one, and there's also cons to this one. You know, there's a lot of, it's not an easy choice, usually, when there are choices. Now, sometimes it's very clear, this is what we need to do, and it's actually relieving when it is clear, you don't have choices, but most of the time, there will be some choice, and sometimes that choice is to do nothing, and that is to watch and wait, and that's a hard choice to make. To know that there is cancer in your body and that's been identified in a prostate or in another organ, and the recommendation is at this point in time we're going to wait, and we're going to carefully monitor and watch how things develop. And that in itself is like, oh, really? Is that what we're going to do? You know, so again, evaluating therapeutic options is sometimes can be overwhelming. We also need to talk about getting a second opinion and some of these other things pretty quickly, but getting a second opinion, I just want you to remind yourself what a second opinion is and what it's not. What it is getting an opinion of another oncologist or another surgeon, another physician who will come to an independent conclusion about what they think either the diagnosis is or what they think the treatment should be. So it's just in the fresh eyes, a different perspective. oftentimes, again, helpful if you've got the time to get a second opinion. It's kind of comforting when the two, if you're getting two, when they agree. That's kind of comforting. It's a little bit puzzling when one's recommending one thing, and they're both reputable. I'm assuming that you're seeking reputable second opinions. And one's recommending one thing and one's something else, and then you're back to that decision making. But it does, if there are different recommendations, it can encourage more conversation, it can encourage more questions. So again, second opinion when there is time. Sometimes the acute leukemias, you don't have time to get a second opinion. Those are diseases that progress very quickly, and you don't have the luxury of 2 or 3 days to wait. In my practice in Augusta, we would have an acute leukemic child. We knew exactly what it was, and it was important to start therapy that night. We didn't. So sometimes no luxury at the time. Let's talk about what a...
Probably didn't have a lot of different options with all that stuff too,
Yeah,
right?
there weren't as many options as now, so it was more clear cut as to what needed to be done. A second opinion, let's look at what it's not. It is not that you distrust your oncologist that gave you the first opinion, or the surgeon. It is not that you're looking for a new physician. It is not that you're searching around for a more desirable diagnosis. So again, I don't want people to be worried that they've got to do this in secret. Yes, tell your oncologist or surgeon, do I have time to seek a second opinion, and is there someone you would recommend? Maybe there's an authority up at the Mayo Clinic, or an authority at St. Jude, or an authority, and they send your records, they send your biopsy, they send whatever, and you do it not like behind somebody's back and feeling bad about it. So again, second opinion, and you can see, I'm not going to read it, but you can see this is a person's quote about how they had greater peace of mind after seeking a second opinion. So it's perfectly fine to do that. Again, I'm not opening up the phone book to pick somebody. I'm seeking a reputable second opinion, somebody with expertise. And then participating in clinical trials. And in my work over the years, I've been a coordinator of clinical trials, phase 1 through 4, but sometimes a clinical trial will be offered. And again, clinical trials are research studies. They're conducted by medical professionals, and really the aim of the clinical trial can be different. So 4 phases of clinical trials. The first phase is just, is this thing safe? If it's a drug, is this particular drug safe? And sometimes you're just giving that, testing that dosage and that drug to somebody that doesn't have cancer. You're just, can the body tolerate this drug? And yes, these people get paid. And there are people out there who, are willing to thankfully, participate in phase 1 trials. Are they safe? And then if it's safe, then you move on to the next level of clinical trial. Phase 2 is if it's a treatment, if it's a drug, does it actually work? So safety first, and then is it by itself, does it seem to have some kind of activity that might be useful against the cancer? Still pretty experimental here, okay? Phase 3 is the treatment better than what's already available? So that's comparing the new drug or modality against what is now standard of care. Okay, and again, it's safe and it's effective. Now you're just looking at it, is it better than drug A that's been around a long time? And then the phase 4, after phase 3, then if it's a drug, the pharmaceutical company can submit application to the FDA for drug approval. Okay. if the phase 3, that it's shown to be more effective or than what's already available, then it can go for approval. And actually, people can start receiving that drug. Phase 4 clinical trial might happen after the drug's already approved, but now you're looking at something else that's of interest, like, well, what happens if somebody takes this drug for 3 years? Is there some kind of delayed side effect, or does the cancer relapse after, you know? So you're just building on that knowledge base. What else do we need to know? Sometimes that phase 4 trial is, does this drug, oh, it works well against this cancer, does it work against another type of cancer? So again, lots of options for clinical trials. Typically, again, they're focusing on treatments, measuring safety. Some of them will focus on prevention. So a lot to think about. And again, they're very well, in this day and age, they're very well controlled. There are some myths and misconceptions about clinical trials. I'm not going to go through them all. But the first one is, well, they're offering me because there is absolutely nothing else they can do. You know, that it's the only, there's no other treatment option. I've got to do a clinical trial, and that must be, you know, that I'm at the end of the line here. And that's not always the case at all. They're not wild experimentation. People do not lose their rights when they join a clinical trial. You can, you have all of you sign an informed consent. They're very detailed in language that people understand. I used to write informed consents for parents who were putting their kids in a clinical trial. So again, and the last one, some patients may only receive placebo and miss out on a real treatment. You would never, on a cancer clinical trial, compare a new drug to doing nothing, okay? You might compare that new drug to standard of care, you know, so you might have a double blind. You don't know if you're getting the standard care or if you're getting a new drug, but you would never be given a placebo drug, okay? So there may be advantages to participating in a clinical trial, and some challenges as well, so it's important to ask those questions and learn all about it and decide if it's something that you're interested in. People who do clinical trials and it works well for them, you know, they are so glad it was available at the time. If you're familiar with one of my favorite podcasters is Kate Bowler with her stage 4 cancer. She participated in a clinical trial that was at Emory, and she talks how fortunate she thinks she was that she was able to do that. And she credits that trial with her survival today. So something to think about for sure. Managing side effects, I'm not going to talk too much about it. You know, every modality and every treatment has the potential to have a side effect. And so it's really important to go in with some knowledge about what those side effects may be and decide if you're willing to, if again, risk and benefit. Yes, I'm going to lose my hair, but yes, that drug's going to kill the cancer. And you weigh the side effects, because inevitably they're going to come. But knowing that in advance, and again, knowledge is power, and will help you manage the side effects. Again, some of these newer modalities, there's not as much nausea and vomiting as there was years and years ago. We've got great medications that seem to manage that better. Many of the drugs now don't cause the hair loss. So again, best to go in, knowledge is power, go in and keep your medical team informed if you do have side effects, if there are side effects.
Could side effects be different? Like if myself and somebody else was taking the same drug, and is it possible that I would lose my hair and the other guy wouldn't?
Yeah, it's something like the hair loss is pretty consistent if it's gonna happen. But some of the other side effects, again, depend on, like the fatigue and the cognitive issues and some of the other things might be more variable depending on an individual person. But again, we're pretty familiar, and that's one of the things that those clinical trials are figuring out. What are the side effects? And one thing that would be on your informed consent, if your choice was to use that drug, do you understand the side effects? And you know, even when we see the drugs advertised on TV or when we go to the pharmacy, the list of side effects is this long. And it's from itching to, well, you may die. You know, it's everything under the sun. So it's just be prepared and know, it will help you. It will help you and your loved one or your friend. You know, not be surprised. Yeah, Rachel.
Atrium Health has a senior oncology clinic that specifically, you have an hour and a half appointment and they assess your cognitive and everything before your treatment. And
Oh,
it's
wow.
wonderful. And so they kind of get a baseline and tell you what to expect. They send you the medicines. Because sometimes the oncology team doesn't have time.
Right.
And this is specifically for seniors.
That's terrific.
And it really helped my mom a lot to anticipate what to expect. And they saw her all the way through her treatment.
Oh, that's great. What's it called again? Just
It's through Atrium, it's the senior oncology clinic.
okay. Yeah, that's great. Really good. Senior oncology clinic. Another option in those, you know, all the things to make decisions about is palliative care. And Amy talked to us last summer about palliative care, not being hospice care. So let's get that out of the way. Palliative care is not hospice care. And this is from the National Cancer Institute. Again, I'm not gonna read it, but palliative care is meant to improve quality of life. And it can be given with or without curative care. So someone receiving cancer treatment who does have a serious life-threatening disease, maybe a lot of things going on, palliative care is an option. And again, that is not a team that's not replacing the cancer team, not replacing the oncologist, but working alongside and offering perhaps pain management. Some cancers, especially bone cancers, very, very painful. So that would be probably a great candidate if someone had metastatic cancer to the bone, that they might need palliative care. But really any kind of serious, more advanced stage where you're more looking at treating the whole person. Patients may receive the care at their home or in the hospital, and really it's looking at managing those side effects and also involving the family. And we're going to talk about the family here in just a moment. Involving the family, a more holistic approach to care. Again, not replacing what the oncologist or the surgeon is doing, but in addition. So don't, I think people now go, oh, they're recommending palliative care for my dad. Does that mean that we are at the end of the road again? And it doesn't. It doesn't. It's just another layer of care. It costs money, obviously. And so the caveat is, does insurance pay for it in our system? In other systems, it's part of their universal health care. Okay, so we're going to talk about working with the medical team, and again, just some recommendations. This is in Dr. Hopp's book about the importance of starting off best you can with a good relationship with your healthcare team, and that may entail doing all of these things or just some of them, but always helpful to bring someone to appointments. But that someone needs to be someone calm, someone able to take notes, someone willing to listen and not, necessarily interjecting every other word. So pick that person who comes along carefully, so that the clinician is not, having to ricochet back and forth between two people. So bring someone to appointments, take notes yourself, or have someone take notes, because a lot of information is exchanged at appointments. If you can, focus and prioritize your questions before you come to the appointment. And remember, in Dr. Houck's book, he gives some great questions I don't even know what to ask. There's some suggestions about questions to ask. If you want to share some information that you found on the internet, or you found some in a medical journal or something, again, some folks are very interested that their oncologists know something and bring a stack of papers like this. So that's not reasonable. So streamline information. What do you think about the journal article? Instead of just dumping a whole bunch of information on your desk. Be empathetic with the team. They're human beings. They can have tremendously busy days, and maybe they're late seeing you or seem a little short or whatever. Give them some grace. Hopefully they'll extend you grace. Again, that empathy with the team, and hopefully you're getting it back from them, will strengthen the relationship. Dr. Houck, and we get to see him in a few weeks. He's going to be in Fort Mill, I think, Jay. He seems to have a sense of humor in his writing, and so he talks here about it doesn't always have to be so serious, and sometimes a little bit of laughter goes a long way. What doesn't work is being passive, okay? Being passive and not being your own advocate, and not just, I feel terrible, whatever you say, and that does not really work to make a strong relationship. Aggressiveness does not work either, okay? And so, a word that we're all fond of in Stephen Ministry is to be assertive. We have a whole book on how to be assertive in a non-aggressive way. And assertiveness does work to establish a good partnership here. Helping your medical team help you, again, not going to go over it all, but it's kind of do's and don'ts. Don't hold back information. Share your information, be efficient with the time. Don't ignore your role in the team. We talk now when I'm talking to potential new providers going out there, we talk about how we have patient-centered care, and the team is focusing on the patient, but who's the most important member of the team? The patient. Patient is a member of the team. They just happen to be in the center, and that should always be the focus of everyone else. So don't neglect your role as a member of the team. Don't expect your medical team to be superheroes. Dr. Houck's word, don't be the patient or family member from hell. And then again, the things on the right-hand side, sort of common sense, realistic expectations, remember that team members are human, take personal responsibility, etc. Caring for yourself, again, what would be something that someone could do right away with the diagnosis? If possible, keep your routine up as best you can. And again, if possible, there's a lot of things that can happen with the diagnosis that make the routine not possible. But if possible, keep up the routine. Choose to focus. It would be nice if you could talk about something else, and where cancer just doesn't consume your life. Not to ignore it, not to give it its due. It's a life-changing event, but not to just drop everything else. that has given your life meaning. As much as possible, keep doing what you enjoy or try something new. And most importantly, just continue to be who you are. And not let this disease transform you into someone that you haven't been. Okay? So easier said than done. But again, you can see a quote here. I have cancer, but cancer doesn't need to have you. I took the time I needed, but lived my life as normally as possible. My life wasn't all about the cancer. This speaks to me as a Stephen minister as to things that maybe if we have a care receiver who is dealing with cancer or walking with someone through the cancer, this might could stimulate open up some conversation about Christmas is coming up. How are you feeling about that? Because holidays can feel different, and that could be a point of conversation. Or what have you done this week that's nice for yourself? That could be a point of conversation. Again, there's just things that we can do in our Stephen ministry practice that could help the person verbalize some of what they're feeling. These are quotes. I just want to talk a little bit relating to the immediate. This is for the person that's been diagnosed, relating to their immediate family. And I'm gonna share quickly about my story. The first one is not my quote, but it spoke to me. Dad's cancer diagnosis knocked our entire family for a loop. It brought all sorts of new challenges, which led to emotions and reactions we had never witnessed before. It was raw, uncharted territory. My dad was diagnosed in November. He died in February, so it was very quick. My dad was my mom's caregiver, and she was about 8 years into Alzheimer's decline. And he was everything. And, I was here in Charlotte, they were in Winston-Salem. As much as we were trying to deal with what my dad was dealing with, it was like, well, what are we gonna do with Mom? Because he wasn't gonna be able to care for her anymore. So there was as much energy, maybe even more, in getting my mom situated. Ended up they both came to Charlotte, where me and my other sister could be of more help. And we worked it out, but for the moment, it was quite unsettling to say the least. Again, I don't know if anybody else sees a quote or wants to share anything related to the immediate family.
Yeah, I'd like to share something. My father also had cancer, lasted about a year, and it brought our family closer together. And it was really kind of an interesting experience. And we're not real close, but that brought us closer. And since he passed, we've kind of separated a bit again.
Yeah.
And not as involved as we were. But at the time, it was, in a way, a positive feeling that
Right.
I think we all had. And so it is interesting how I can drive things in different directions,
Yeah.
just depending on the situation.
I like the one up on the right. I was raised in a we don't talk about our emotions family. That resonates with some people.
Yeah.
So when my husband would ask me, how are you feeling? And maybe this goes a little bit with our situation right now. How are you feeling? The person would say, I would talk about my fatigue or my nausea. Once I realized what he was really asking, I discovered how much more I had to tell him. Talking about my frustrations, my worries, my joys, and in that way, having a deeper level of connecting. So again, I guess the point is, everybody's going to relate to immediate family probably in different ways. There's no right way, no wrong way, but be prepared for it to be different from what it was before. Let's put it that And then relating to people beyond immediate family. So this is an image from Nourish Up, but this could be a member of the care team bringing a meal to a person. You know, how do you relate to that person? Maybe you don't know them very well. So you only, again, need to update others as much as you want to, or are able to. It's not like you have to bare your soul, you know, to everybody that walks in the door. And there may be a select few that know the entirety of what you're going through, and there may be other people who are interested, but you don't have to go to that kind of detail. It's really up to you. Seek listeners, not lecturers. How many people have been sort of telling their story, and then before they can even finish, somebody's saying, oh, when my mother had that, you know, they start telling their stories. And, or I think you ought to, the person who has some strong feelings. So I love this. Find 1 or 2 AAA friends, or I'll call them 5-star friends. 1 or 2 really good friends who you can share everything you're feeling, the good, the bad, and the ugly. And that doesn't mean you need to do that with 20 people. You know. Tell others what you need. Accept the feelings that other people go on with their lives. You know, perhaps your family's going through a cancer diagnosis of a loved one, and Christmas is going to be different, and everybody else is just going skiing and doing this and doing that, and it's like you live in a different universe, alternate world. So we just have to accept those feelings, and again, avoiding toxic individuals. If people around you are getting under your skin, or you can't seem to get them to understand what you don't need from them, is just to avoid those kinds of things.
They ignore raised eyebrows.
The way people like if you were the person with cancer and you were expressing a feeling and you get that body language or that raised eyebrow, like, really, what? Or, you know, just that sense that you're being judged. Yeah, judgment. So there's ways to find additional support. Again, support groups abound. And your oncologist team will probably can direct you to some good support groups. Definitely be open to professional counseling. It's a big life change, and so professional counseling can help go through. I didn't put Stephen Ministry, but that is an option, or one-on-one, just care and support. Christ-centered care and support is what we offer to someone, and it's confidential. Privacy is protected, etc. So additional support. Let's talk spiritual matters, because again, this is a diagnosis where oftentimes there can be a crisis of faith. Not always, but it can bring a crisis of faith, whether you have a strong spiritual belief or have no spiritual belief, or you find yourself somewhere in between. So these are some of the questions that may come up. Why me? Why this? Why now? Where is God in all of this? You see some of the others. So I would think, again, Dr. Howe talks a lot about this. Remember, he was helping walk his wife through her cancer diagnosis. And he talked about himself, a pastor and a clinical psychologist, touching the core of who you are and what you believe, causing you to ask some tough, profound, urgent questions. So really isn't exclusive to one faith tradition or people with no faith. Many people commonly will wrestle with what they believe about themselves, what they believe about their lives, what they believe about God. And so, an area that we need to think about. And just like we talked about the emotional roller coaster of treatment and the progression, there's also a spiritual roller coaster where someone's faith may vary. They can be angry. At the times, they get a good report back. They can be so grateful and so feeling God's love and care. And then the next time, perhaps not such a good report or a bad side effect, and they feel down again or abandoned or lonely. So we've got to recognize this spiritual roller coaster in addition to the emotional roller coaster we talked about before. The other thing is being totally honest with God. So again, if we're wrestling with God, sometimes that may bring us to our knees. And you know, why? Why me? Why now? Why my baby? Why my, you know, it's just so human to have these feelings, and we need to honestly let God know what we're thinking, and know that in doing so, we're in pretty good company. We can think of Job, and we can think of his struggles, and we can think of in the Psalms where David is crying out, and we can think of Ecclesiastes and Lamentations, and we can think of Jesus in the Garden of Gethsemane, I can never say that, and on the cross, crying out, dismayed, abandoned, given up. You know, we have all these examples, and so you're in good company if that's what you're feeling and thinking and wondering, where is God? God wants to have a relationship with the real you, not some performative prayer. The real you. You don't need to filter your words. You don't need to filter your language. And again, this is Dr. Houck's word. God can take whatever you dish out. Whatever you dish out, and will love and accept you no matter what. And many people will describe a release of relief if they can let it all out. Again, whether you were just crying or just silently praying or shouting out the words, there can be relief in that. And you know, I wish now in hindsight I had explored more of this with my dad. He was a man of faith, a really strong Christian, but pretty much kept things to himself, more concerned about the whole cancer journey, more concerned about my mother than himself. And I can imagine him being on his knees talking about my mother and her future, but I wish I had explored a little bit more about what he was feeling.
I echo that, and I wish that I had been more bold
Yeah.
in my approach with my dad.
Right.
And, it's an opportunity.
We can encourage people to exercise their spirituality ourselves. So this is a quote saying someone was diagnosed and then got into the habit of reading a devotional every morning, got into the habit of saying a prayer every day, and those habits were sustained and remained with them, and were anchoring. And so there's all sorts of ways to exercise spirituality. Can anybody think of any besides reading a devotional and praying? Some other ideas?
I think having that discussion, just like you and I were saying, just
Yeah.
being bold enough to have that discussion,
Just,
bring it up,
yeah.
with others.
And if someone doesn't want to engage in that kind of conversation, you'll know pretty
Yeah,
quickly.
yeah.
And you don't need to push it, but yes.
Walking, I just read that something yesterday, that there's a study that, and this is not directly related, but I think it applies, that, kids who are doing their homework and sitting all day and getting stuck and just sitting, that those that got up, walked, even on a treadmill,
Right.
didn't have to be out in nature, that their cognitive abilities were
Yeah,
tested much higher.
yeah, that's interesting, and
I
I'm
thought
not.
it was interesting that it wasn't just being out in nature.
Right, just getting
Just
up and moving,
moving.
and that was one of the things, suggested, just getting up, change of scenery, music, nature, walking if one's able, serving others, taking communion. In some faith traditions, being anointed, someone's denial. But, again, these disciplines or practices that might, reinforce that deep dive into spirituality. Seeking out a spiritual community, and, we have such a wonderful community here, so that's why I have this image here, but, there is something special about a caring church family. And of course, we're not just a building, this is who we are. And, if you look at our vision statement, we care for all in our present. And, again, I hope church members feel that love and that access to support. I know that there's some that don't. I myself, at an earlier time when I was a member of church, I was a care receiver. I had a Stephen minister. Those of you who've been around a long time, and I can share because it's my knowledge, was Willie Brock. What a beautiful Stephen minister. So I felt that support. Some people need to be nudged to accept support, but again, having a spiritual community obviously really is important. So God bless the journey wherever you're on, either yourself or a loved one or a Stephen minister looking at like you might help someone in the future or maybe helping someone now. God bless the journey. Remember that a lot of this presentation is based on Dr. Houck's writing in Cancer Now What? I'm still listening to the Emperor of All Maladies. In fact, listened last night when I woke up in the middle of the night about how pap smears came about as a screening tool in mammography. Fascinating. Reads like a novel, honestly. So wherever you are or the opportunity you have in the future, I hope this has been beneficial. Amy will be here next Sunday, as I will. Originally, I didn't think I would be here on the last Sunday, but Bob and I are not flying out of the state until Monday, so I'll be here.
Good.
Amy does have a story to tell. And it involves stem cell transplant, and she's had significant diagnosis, significant treatment, and is thriving today. So we'll hear her story. Anyone else? We'll just talk about stories next week. So I am looking forward to that. And wow, did I finish a little early today? Usually I'm like, oh.
But that's really good.
Yeah, thank you.
Let me mention, the books, you can get them on Amazon. I think, Becky, you mentioned that Emperor of All Maladies, there's a new
one in November.
November.
So I would wait on that one.
Cancer Now What, either on Amazon, or if you let me know, I can order from Stephen Ministry, and I think the price is essentially the same, but either way would be
Yeah.
good.
Right.
Jay, I'll try to get these books in the library too.
Okay.
I'm gonna try to
Oh, that would be great. Yeah, I think too, again, the practical guide is truly what it says. It's a practical guide, and you don't really have to read it cover to cover. You just look in that index and go, well, that's exactly what I need to find out. I need to know what questions to ask. And there will be a good amount of information, easy to read. But, oh my goodness, again, I wish I'd had that, and I'm a healthcare provider that worked in cancer, but I wish I'd had that, because it dealt more with the emotional and the feelings and the, you know, the whole spectrum of the disease. So I do think it's, and again, we have the opportunity to see Dr. Howe, in October. Now, anybody can go.
Right, anybody can go.
Anybody can go. It's the 50th anniversary.
The 50th anniversary of the founding of Stephen Ministries. So, and it's amazing that Dr. Howe is still with. I mean, he's an older guy and still has a lot of energy and is very involved. It'll be very interesting to see him in person.
Yeah.
These presentations have really been helpful. I'm anxious to read the book because my care receiver said he got a copy of the book, was given a copy of the book, and he said, I said, what did you think of it? I haven't read it yet. And he said, it was very beneficial, but I wish I had had it before my diagnosis.
Yeah.
He said it covered a lot of different areas, some that I thought of, some that I hadn't thought of. So I'm anxious to follow this up by reading it.
Yes, you can see at the beginning of the book, if anybody wanted to take a look, there's a whole 2 or 3 pages of testimonies, basically, or reviews from people who have read the book, and you know, of course, they're going to put all the good things, but there are just some incredible comments about how useful it was. There is. So.
There are a couple of books on the table with the coffee and the donuts. Please take a donut and eat a book. Take a bookmark. There's also some bookmarks in this book. But anyway, you can look at those books, and I'll work with Gail to get some in the library.
Come on, stand up.
Great. Thank you, Becky. That was really great. Thank you.